Hello friends, welcome to youtube.com oblique drvet drvet channel. I'm Dr. P.R. Patel, Professor and Head, Veterinary Medicine. Here we deal with a very important and commonly occurring field disease, bacterial disease, Naval. In part 4, we'll study special attention to Omphalophlebitis. We'll deal with introduction, science, diagnosis, and treatment. Introduction on Omphalophlebitis. You know that umbilical vein extends from navel a local to the liver, so it has a long course. Inflammation of umbilical vein is called as omphalophlebitis. There are two types of infection and inflammation: local infection and inflammation of only a distal local part, that is at a navel of umbilical vein may occur, or the other is extension of infection and inflammation from local umbilicus to the liver and sometime in the liver also. The course of umbilical vein is from local navel cranially to the liver. So development of large abscesses occur anywhere along the path of the umbilical vein cranially to the liver. Sometimes the infection spread to the liver. Development of large hepatic abscess in the liver, and that may occupy space up to even one half of the liver. That may also occur. That is a very serious and severe condition. We discuss here clinical signs of omphalophlebitis. It is generally occur in calf at 1 to 3 months of age. Due to infection, there is chronic toxemia. The calf expresses chronic weakness, unable to suck the mother. There is unthriftiness, inappetence, reduce the appetite for the food, and weakness. Due to infection and inflammation, a mild chronic fever is observed. The abscess found at the navel, called a distal abscess. There is enlargement of umbilicus locally. There is abscess there containing a purulent material. Diagnosis is very easy. Just palpation locally, clinician find enlarged large mass at the navel. And on exploratory puncture, there is a pus comes out that confirms that there is abscess. We have seen that the distal abscess occur locally at the navel, can be easily diagnosed. Sometimes deep abscess occur. In some cases, the external part of the umbilicus looks normal size, normal, perfectly normal. But there are deep abscesses along the course of the umbilical vein from navel to the liver. Diagnosis of deep abscess. The distal abscess, local abscess at the navel can be diagnosed very easily. But deep abscess require special palpation, deep palpation. In this, keep the calf dorsal recumbency, the vertebral column touches the ground and legs are up. Then start deep palpation of the abdomen. Palpation starting from navel to the cranial direction to the liver along the course of the umbilical vein. And on the course, clinician may find presence of abscess. By posing the calf on dorsal recumbency and starting the deep palpation from navel along the course of the umbilical vein to the liver, the clinician finds a large space occupying mass, that is abscess. Sometimes abscess is found even in liver also. This can be confirmed by ultrasonographic method. Ultrasonographic method not only help in the diagnosis of presence of deep abscess, but it provide a guidance for the surgical procedure. Because if the location is known, then surgical procedures can be planned accordingly. Treatment of omphalophlebitis. If there is local inflammation or local abscess, cure with the local treatment, treatment of abscess, proper dressing, treatment of fistula. But if in deep abscess cases, carry out the antibiotic therapy for a long time, parenteral. But this is also generally unrewarding because the abscess is very deep. Exploratory laparotomy and surgical intervention, complete removal of the whole abscess is the perfect treatment for deep abscesses. Sometimes large hepatic abscess is observed. This is generally incurable. It is as much large that it occupies half of the liver area. In such cases, effective treatment of hepatic abscess is surgical removal of the abscess. If resection of abscess from the liver is not practicable, then provide channel for drainage to the outside surgically and daily irrigation of the abscess and daily antiseptic dressing may cure the case. We have seen the details of omphalophlebitis, introduction, clinical signs, diagnosis and treatment. For more videos on animal disease, please visit our drvet channel. Share the information to veterinary and veterinary students. Press like button. Subscribe the channel to promote the channel. Thank you very much for observing this video.